And welcome to the 23-hour Crisis Relief Centers for Youth information gathering today. I'm going to give a few more minutes to let people call in and get settled and get out of the waiting room. So we'll start in just a minute. Okay, good morning, everyone, and welcome. Again, welcome to the 23-hour Crisis Relief Centers for Youth gathering session. I would like to begin by expressing our sincere appreciation and gratitude for your presence today. Your time, experiences, and expertise are valuable to us as we come here to discuss how we can set some new rules and guidelines for this program. I'd also like to extend a special thanks to the technical team who supports us bringing you this presentation today, making sure that all of us are taken care of and everything runs smoothly. So thank you to each of you. This webinar is designed with you in mind. This space is for asking questions, offering feedback, and together hoping to elevate the key ideas and themes around this program. Before we begin, I'd like to mention that this meeting is being recorded. So it is open to public disclosure, so please be careful on what you share. Lastly, I just want you guys to know that this is being recorded. We will provide the recording out and the slides and then also the notes from each breakout session. So you will have a complete package of everything that's discussed here today. And with that, it's now my pleasure to turn it over to Pedro, who will take us through the rest of the session. Pedro.
On screen, what we have right now is an outline of where we would like to take today's conversation. I'm going to provide a little bit of legislative history, where we have come from, and then some program updates. And then from those program updates, we're going to have two breakout sessions. Breakout session 1 with a couple of questions, breakout session 2 with a couple of questions. And then, as Jennifer has already stated, we're not going to come back and do a report out the way one would traditionally do, in order to give us ample time to talk and ample time for everybody to be able to express their thoughts and opinions. We are going to take notes and send those notes out with the slide deck at the end of our presentation. So that should take us about an hour's worth, or a little bit less than an hour. Some of what we hope to accomplish today: communicate program history and updates, foster community collaboration and open dialogue, collect community input. And there's a reason why collect community input is smack dab in the middle, because that's really what we are trying to do here: collect community input so that our programming activities actually are responsive to the community. We also are hoping to identify key issues and priorities for program development and ensure future rulemaking addresses key program development concerns. So, 23-hour crisis relief centers, how did they come about? They came about in 2023 with a second substitute Senate Bill 5120. And what that bill did is it authorized 23-hour crisis relief centers, which are new to Washington. And these are facilities that are created to be, they're open 24 hours a day, 7 days a week, but the stays are limited to 23 hours and 59 minutes. Admissions are limited to adults, and that's by design here. When 23-hour crisis relief centers first came on board, there was a recognition that not all programming for adults can be easily translated into programming for youth and children. And so the access for this particular program, when it was first initiated, was limited to adults. We're in a different season now, and that's why we're here. Program certification is regulated by the Department of Health, and program certification is another way of saying minimum licensing standards. Again, the word minimum is key there. Minimum licensing standards. Program development is different. We are not talking about whether a facility has, for example, a fire extinguisher on the wall. We're talking about more program related things, types of services, types of supports, things like that. Substitute Senate Bill 5120 also ordered a few services to be included in 23-hour crisis relief centers. This is a pretty comprehensive list. There aren't many, but that's what legislation does. So crisis stabilization, first and foremost, this is designed for individuals experiencing a behavioral health crisis. Medication management, if you notice, medication management has an asterisk next to it. And that is to highlight the fact that in a 23-hour facility, we're not talking about long-term management of psychotropic medications. We're talking about dispensing over-the-counter medicines. We're talking about perhaps dispensing previously prescribed medications, but that's about it. For a 23-hour facility, we don't have people around to really, like I said, do long-term management of psychotropic medications. Also included in the programming will be physical health screens and minor wound care. Suicide assessments and coordination with the involuntary treatment system.
That's got a voice.
Our referrals will be coming from the 988 crisis line. They'll be coming from first responders, and they'll be coming from law enforcement. There is, in fact, a requirement in legislation to include law enforcement drop-offs and whatever it is minimum licensing requirements do, and whatever it is that our program development does as well. So just keeping that in mind. In 2024, then, that is when we have the legislation, including now young people. But this legislation doesn't, second and gross substitute Senate Bill 5853 does not change the structure of the 23-hour crisis relief centers. It pretty much remains the same. What it does is it expands the criteria, admission criteria for children ages 8 and above. So for children, we're looking at ages 8 all the way up to and including age 17. Once a person becomes 18, they are, per this legislation, considered an adult. Providers who are currently engaged in serving adults are going to have the option to also serve children. An agency can serve adults, could serve children, or could serve both. And again, just as a reminder, rulemaking is hosted by the Department of Health. Rulemaking being minimum licensing requirements. Bill 5853 also specifies a few additional things. Number one, we got to ensure that there is no contact between youth and adults. So we're talking about maintaining private treatment areas, maintaining different entrances, different exits. If an agency is going to be serving both youth and adults, these are the things to consider. For an agency that's serving just adults or just youth, well, this wouldn't be an issue. Another thing that was specified in legislation is to make sure that we make connections, that we connect families to existing community-based supports. and that we address discharge planning for youth at risk of foster placement or homelessness, as well as it ensures that we coordinate with key system partners to ensure follow-up services are available. And that'll be key as we move into our breakout rooms is follow-up services. Keep that in mind if you would. So as the Healthcare Authority was considering this legislation, there were a few concerns that popped up for us. This is a list of some of those concerns. Youth with intellectual or developmental delays were not explicitly mentioned. They weren't cut out of the picture, but they also weren't explicitly mentioned. Youth with co-occurring disorders were also not explicitly mentioned. And again, they weren't cut out of the picture. They just were not explicitly mentioned. We didn't receive guidance for cases where parents refuse to take youth home after discharge, or the reverse, where a youth doesn't want to go home after discharge. There was no requirements to coordinate with youth serving mobile and rapid response crisis teams, and that we feel is very important. It also leaves a risk of discharge planning focusing too much on facility and residential-based care rather than community-based care. This is very important. In the state of Washington, we are trying to create a path for behavioral health services to go more toward community-based care rather than institution or hospital-based care. So what's next? What's next is program development. What's next is us at Healthcare Authority being able to receive information from you as to the types of things that should or should not be included, the types of things to be aware of as we are building this program. Your insights and your participation are crucial to us. They're important to create a supportive and therapeutic environment for children. They're important to develop a continuum of crisis care that meets young people's needs. They're important to identify implementing best practices, and they're important in order to find innovative solutions to potential barriers. We can do this together. Together, we can develop the program standards that meet the needs of our youth. We can identify best practices. We could find innovative solutions. We could make the crisis relief centers effective and responsive to our youth. And that's what we're all about here today. That is our primary goal. In a moment, we're going to be going out into breakout sessions. There's going to be 2 breakout sessions, like I said. This is an opportunity for you, our community partners, for you individuals with lived experience to be able to tell us what facility features are needed in a 23-hour crisis relief center for youth to be successful, as well as what barriers, what gaps, what concerns should DBHR be aware of as we move into program development activities. You've just heard what HCA feels are some of the concerns, but what do you feel are the concerns? Most importantly, coming from our system partners, coming from individuals with lived experiences.
Waiting for folks to pop back on, but while they are, I just want to say our 2 breakout rooms that I were in were great. We got a lot of good information, and I know Pedro's got a final slide, but I encouraged my group on the way out, so I know there must be others. Our emails are going to be on the last slide. If you had thoughts that you didn't get to say into the room, we'd still love to hear them.
Hopefully we're all back and we can all see my screen. Well, thanks everybody for being here. I hope everybody had a fruitful conversation. I was just hearing from some of the participants that in their group, they felt it was a fruitful conversation. I also know that there was at least one group with some technical difficulties. My sincerest apology for that. We did get your feedback, as well as we have all the feedback that was there in the chat. So just be aware that we did receive the feedback, and thank you so much for being here. We have just a few minutes left on the clock. I'm wondering if anybody has any last minute thoughts, any last minute concerns, last minute questions, anything like that for us.
I just want to say to Megan in the chat, we will be sending out the slides and the recording and then all the notes from the breakout session. So you guys will all have a complete package of what was discussed here today.
Thank you. And with that said, folks, there's no reason to keep us here longer than need be. Up on screen, you have my contact information, and you have Liz Venuto's contact information. I'm the project lead for implementing youth 23-hour CRCs in the state of Washington. Liz is my supervisor. If you have any questions, if you have any additional feedback, if maybe you just want to chat and say thanks for the opportunity, go ahead and give me a ring or give Liz a ring. And again, thank you everybody for being here. Have a good day.
Thank you.